Hi everyone, my name is Freshta, and today I'll be walking you through my research on predicting the risk of heart attack in patients with alcohol use disorder using machine learning. This sits at the intersection of two very important fields, public health and data science. By the end of this presentation, I hope to show you how powerful these tools can be when applied to real clinical challenges. Let's get started. To understand why this research matters, let's start with the bigger picture. Heart disease is the leading cause of death in the United States and globally, responsible for millions of deaths every year, according to the American Heart Association. Now, many factors raise a person's risk for heart disease, things like smoking, obesity, poor diet, but one factor that often gets overlooked is alcohol use disorder. Um, CDC tells us that heavy, chronic alcohol use directly harms the heart. It raises blood pressure, dis- disturbs the heart's natural rhythm, and weakens the heart muscle over time. This means that people struggling with alcohol use disorder are at a significantly higher risk of experiencing a heart attack. So the question becomes, can we identify these high-risk patients before something serious happens? The objectives are straightforward. First, we want to build a machine learning model that can predict heart attack risk, specifically in patients with alcohol use disorder. Second, we want to identify which risk factors matter most in driving that risk. Not all factors are equal, and understanding their weight helps clinicians focus their attention. And third, we want to compare different machine learning models to find out which one performs best for this task. Ultimately, the goal is to put a data-driven early warning tool in the hands of healthcare providers. So, what data do we use for this model? For this model, we are working with electronic health records, the kind of structured clinical data that hospitals collect on their patients every day. Key variables include things like age, alcohol consumption level, blood pressure readings, cholesterol levels, diabetes history, and other relevant medical conditions. Um, and what makes this data powerful is that it reflects on real patients with real histories. The machine learning model analyzes all of these variables together, looking for patterns that the human eye might miss, and uses those patterns to estimate the risk. Now let's talk about the machine learning models. For this type of prediction task, called binary classification, high risk versus low risk, several models are commonly used. Logistic regression, which is simple, is easy to interpret, and it's a strong baseline. And then we have decision tree. It's easy to visualize and explain to clinicians. And then we have random forest, which is more powerful and uses many trees together for better accuracy. Support vector machine is effective at finding the best boundary between risk groups. um, so each model has its strength and trade-offs. Some are easier for a doctor to interpret, while others are more complex, but they may deliver better predictions. That's exactly why we compare them, because in healthcare, both accuracy and explainability matter. So once we train a model, how do we know if it's actually doing a good job? That's where evaluation metrics come in. We use four key measures. Accuracy tells us overall how many predictions the model got right. Precision answer all the patients the model flagged as high risk, how many actually were high risk. This matters when we want to avoid unnecessarily alarm. Recall answers all of the patients who truly were high risk. How many did the models catch? In healthcare, this is critical. Missing a high risk patient could cost them their life. And then we have IUC, the area under the curve. which gives us a big picture measure of how well the model separates high risk from low risk patients across all possible thresholds. In a medical setting, we tend to prioritize recall and AUC because the cost of missing a true case is far greater than the cost of a false alarm. Precision is important when false positives are costly. Recall is important when missing a true case could be dangerous. In healthcare, recall is often very important because missing a serious disease could harm the patient. AUC gives an overall measure of model performance across different thresholds. Now let's take a step back and look at the key risk factors that research has consistently linked to heart attack. These include older age, smoking, high cholesterol, high blood pressure, diabetes, obesity, and of course alcohol use disorder. What's particularly interesting is that alcohol doesn't just add one risk, it compounds others. It raises blood pressure, it damages the heart muscle, it can interact with medication. Machine learning is uniquely well suited for this because it can analyze all of these factors together and weigh their combined effects on risk, something traditional methods struggle to do. This diagram gives a visual representation of the relationship we are studying. As alcohol consumption increases, particularly at heavy or chronic levels, the risk of heart disease trends upward. But it's not a perfectly straight line, and the relationship is influenced by all those other risk factors we just discussed. That's the complexity that machine learning helps us unravel. By learning from real patient data, the model can quantify how strong this relationship is and where the danger zones actually lie. So what are the real world benefits of applying machine learning here? One of the biggest benefits is earlier detection. A model can flag high-risk patients before symptoms appear, giving doctor a critical window to intervene. Better treatment decisions. When clinicians know which patients are most at risk, they can prioritize resources, adjust medication, or recommend lifestyle changes. And it also reduces healthcare costs. Prevention is always cheaper than emergency treatment. Identifying risk early can reduce hospitalizations and improve outcomes. And importantly, machine learning supports doctors. It doesn't replace them. Think of it as giving clinicians a smarter, faster second opinion. To wrap up, machine learning has real, meaningful potential for predicting heart attack risk in patients with alcohol use disorder. By analyzing complex patterns in clinical data, these models can help healthcare providers act earlier and more precisely. The next step for this research involves testing on large, more diverse datasets and exploring more advanced models to push accuracy even further. Ultimately, the vision is simple: better data, better predictions, and better patient outcomes. This concludes my presentation. Thank you so much for your time, and I'm happy to answer any questions you might have.